Hello, and thank you for joining us today. My name is Gail Tucker, and I'm a health plan consultant with CommunityCare. I'll be your guide as we walk you through CommunityCare Senior Health Plan benefits for 2026. We know that making healthcare choices can sometimes feel overwhelming. That's why this presentation is designed to give you clear, straightforward information so you can feel confident about your choices. At CommunityCare, we're here to support you every step of the way, so let's get started. We're excited to share that in 2026, our provider network has expanded. This gives you more choices for your care and makes it easier to connect with the specialists and services you need. We understand how important it is to feel comfortable with your healthcare team, and we're committed to helping you find the right fit. You'll continue to choose a primary care doctor, and you'll have the flexibility to see specialists within any of our contracted health systems. If you ever need specialty care that isn't available within our provider network, don't worry. CommunityCare has access to several centers of excellence, which you'll see highlighted on this slide. To use these clinics, your in-network doctor will submit an authorization request. Once it's approved, a dedicated case manager will be there to guide you through the process and support you every step of the way. At CommunityCare, your health and well-being are always our top priorities. That's why your annual wellness visit is still covered at no cost. It's a great time to sit down with your doctor, review your medications, and address any concerns you may have. If you ever decide to change your primary care physician, we'll walk you through the process and make the process easy. You can call our customer service team or use the CommunityCare portal or mobile app, which I'll share more about a little later in this presentation. We want to be open with you about a few updates for 2026. For your convenience, changes are highlighted in yellow. Premiums will increase slightly. We understand that any change can cause concern, but these adjustments help us maintain the quality of care and broad range of services that CommunityCare is proud to provide. The Platinum Plan premium will move from $19 to $24 and Platinum Plus from $83 to $97. Maximum out-of-pocket limits are increasing a little as well, but they remain right in line with the other plans across the country that we are seeing. Doctor's visits will still have a zero copay. Specialists will go up by $5 for Silver Plus and Platinum, but they are still the same for other plans. The emergency room copay will now be $120, though Silver members will see no change. It will remain at $90. Urgent care visits will increase by $5 for Silver and Platinum, while Platinum Plus and Silver plans remain unchanged. We know that health care is personal, and our goal is to make these changes as smooth as possible while continuing to give you the dependable, high-quality coverage you deserve. A common question we hear is, what happens if I have a medical emergency while traveling outside the CommunityCare coverage area? The good news is you're still covered. You have access to both urgent care and emergency care no matter where you are. For 2026, the emergency room copay is $120, up from $90. For urgent care, you'll simply pay the specialist copay. And here's something important to know. If you are admitted to the hospital within 48 hours of your emergency room visit, the emergency room copay is waived. From there, you'll pay the same copay as you would at an in-network hospital, which we'll review on the next slide. Here are a few important updates to your benefits for 2026. Inpatient care copays on some plans have increased and will now apply for 7 days instead of 5, but Silver members will see no change. Outpatient hospital copays are also increasing across most plans, while Silver remains the same. Home health care continues to have a zero copay, though prior authorization is still required. Physical therapy copays will increase by $5 for Silver Plus and Platinum plans, while staying the same for Platinum Plus and Silver. These updates help us keep your care affordable, while many key benefits remain unchanged. There's good news. There are no changes to the copays for ambulance services, skilled nursing facility care, or diagnostic radiology services like MRI and CT scans. We're often asked about ambulance copays when a city utility service offers its own ambulance coverage program. In those cases, you may be able to request reimbursement of your copay through that program. And just a quick reminder, prior authorization is still required for non-emergency ambulance rides. For skilled nursing, your coverage remains the same. There's a zero copay for the first 20 days on all plans. Starting in 2026, a Part D deductible will apply. Silver Plus, $615 deductible, Platinum and Platinum Plus, $200 deductible. We understand this is a big change, but here's what's important to know. The deductible only applies to Tier 3, 4, and 5 prescriptions. Tier 1 and Tier 2 generics will remain very affordable, starting at just $0 or $5. Once you've met your deductible, you move into the initial coverage stage. This is where you'll pay a set copay or sometimes no copay at all for most of your prescriptions. Once you reach the true out-of-pocket amount of $2,100, you'll move into the catastrophic phase. At that point, you'll pay nothing for all of your covered prescriptions. Let's take a closer look at the deductible. This is the amount you pay out of pocket before your plan begins to pay. $615 for Silver Plus, $200 for Platinum and Platinum Plus. It's important to note that Tier 1 and Tier 2 and select insulin prescriptions start right away in the initial coverage stage, so the deductible does not apply to those. And if you qualify for extra help through Social Security, the deductible won't apply to you at all. We know this is a new change for 2026, and we're here to guide you through it with care and understanding. Now let's review your Part D prescription copays for a 30-day supply at retail pharmacies. Tier 1 preferred generics remain at $0. Tier 2 generics are $5. Select insulin is set at $35. Tier 3 preferred brand prescriptions have a 20% coinsurance on all 3 plans. Tier 4 non-preferred drugs are 25% coinsurance on all 3 plans. And Tier 5 specialty has a 25% coinsurance on Silver Plus and 30% on Platinum and Platinum Plus. Remember, the deductible only applies to Tier 3, 4, and 5 prescriptions. Tier 1, Tier 2, and select insulin start right away in the initial coverage stage, so the deductible does not apply to them. Managing your medications should never feel like a burden. In 2026, your mail order service now includes Costco and continues with Walgreens, while CVS Caremark is no longer part of the program. With mail order, you can get up to a 100-day supply of your prescriptions, helping you save money and avoid the worry of running out of your medications. It's important to note, removing CVS from the mail order service does not affect your ability to fill prescriptions at a local CVS retail store. You'll just need to move any mail order prescriptions over to Costco or Walgreens. As you see here, Tier 1 and Tier 2 generics are still a $0 copay through mail order, and select insulin is $105 for a 100-day supply. For higher tiers, coinsurance supplies and specialty tier medications remain limited to a 30-day supply. If you're facing high drug costs, the Medicare Prescription Payment Plan can help. This program lets you spread your payments out over time with no interest and no fees. Our goal is to make sure cost never stands in the way of your health. If your prescription out-of-pocket costs are expected to come close to the $2,100 true out-of-pocket amount, you may qualify. If you're interested, simply call our pharmacy department. Their number will be provided later in this presentation. There are no changes to your Medicare Part B drug coverage for 2026, and these costs continue to count toward your maximum out-of-pocket. You'll pay between 0 to 20% of the cost for chemotherapy drugs, infusions, and other Medicare Part B medications. As a reminder, Medicare Part B covered insulin remains just $35. Our vision and transportation benefits are a great resource, and many members may not even realize just how valuable they are. For 2026, there are no major changes except one improvement. The one-way transportation limit has increased from 50 miles to 60 miles. Your vision benefits continue to include a zero copay for one routine eye exam each year, plus medical eye exams, and either a $400 or $200 allowance to help cover the cost of glasses or contact lenses annually. For transportation, you'll still have zero copays for 12 one-way trips or 6 round trips for medical appointments. Just remember to schedule your ride at least 48 hours prior to your appointment. These benefits are designed to make it easier to get the care you need and to help keep your vision and mobility a top priority. Dental health is an important part of your overall well-being, and we're committed to helping you keep a healthy smile. For 2026, the dental benefit maximum will be $1,000 total, combining both preventive and comprehensive services. While this is a change from last year, your preventive benefits remain the same, covering 2 oral exams, 2 cleanings, and 1 set of bite wing x-rays each year. Dental health is an important part of your overall well-being, and we're committed to helping you keep a healthy smile. For 2026, the dental benefit maximum will be $1,000 total, combining both preventive and comprehensive services. While this is a change from last year, your preventive benefits remain the same, covering 2 oral exams, 2 cleanings, and 1 set of bite wing x-rays each year. With these benefits, our goal is simple: to keep preventive care affordable and support your dental health as an important part of your overall wellness. Our hearing benefits will remain the same for 2026. You'll still have a zero copay for 1 routine hearing exam each year from your primary care provider, as well as a zero copay for diagnostic hearing exams. For hearing aids, members on the Silver Plus plan may use their Fitness Plus card toward the cost up to the benefit limit. Members on other plans have a zero copay for up to $500 toward hearing aids. This benefit can be used once every 2 years. Please remember, all hearing aid fittings, evaluation, and purchases must go through Nations Hearing. There is also a zero copay for 1 evaluation and fitting every 2 years, available on all plans except Silver Plus. These benefits are designed to make hearing care more accessible so you can stay connected with the moments that matter most. Let's review your over-the-counter benefits for 2026. Silver Plus and Silver members receive a $30 quarterly allowance. Platinum and Platinum Plus members receive a $40 quarterly allowance. This benefit can be used to order over-the-counter medicines, first aid supplies, and even some bathroom and safety devices. Orders can be placed anytime during the quarter, either online or over the phone, and your items will be delivered directly to your home. Just remember, any unused allowance does not carry over to the next quarter, so be sure to use it before it expires. To place an order, you can call Nations Over the Counter or visit ccok.nationsbenefits.com. Staying active is one of the best ways to support your health and independence, and that's exactly what the Fitness Plus benefit is designed to do. Formerly called the Wallet benefit, this benefit can be used toward gym and fitness memberships. For 2026, Silver and Silver Plus members receive $200 per year, while Platinum and Platinum Plus members receive $250 per year. Your funds are conveniently loaded onto your Fitness Plus Benefit MasterCard, making it easy to use. In addition to memberships, these funds can also be applied towards certain medical items not covered by Medicare, and even wearable fitness devices like Fitbits up to $100 per year available through the nation's benefits store. It's a simple and flexible way to stay active, stay healthy, and support your overall wellness. The best way to take advantage of the OTC and Fitness Plus benefits is to register for the Nation's Benefits online store at ccok.nationsbenefits.com. Once you sign into the Nation's Benefits website, managing your benefits is quick and easy. You can shop for over-the-counter items, activate your Fitness Plus card, check your benefits, and even order replacement cards all in one convenient place. We encourage you to take advantage of the CommunityCare member portal at ccokadvantage.com. This easy-to-use website gives you quick access to your benefit details, claim information, the option to print temporary ID cards, and much more, all right at your fingertips. Here's a screenshot of what your member portal looks like once you have logged in. CommunityCare also has a mobile app for your phone that is available in both Apple and Google Play Store. You can also scan the QR codes here and go directly to those stores to download the free app. Be sure to keep your information with CommunityCare up to date. Let us know if you change your address, your phone number, or your primary care physician. Keeping your records current helps us serve you better and ensures you get the care and support you need. Our CommunityCare customer service team is here to help. You can reach us Monday through Friday from 8 a.m. to 8 p.m. During the busy season, October 1st through March 31st, we extend our hours to include Saturdays, Sundays, and even some holidays, so you'll also have the support you need. And if you ever have any questions about your prescriptions, our pharmacy help desk is also available to assist you. In summary, your senior health plan continues to provide comprehensive coverage, expanded provider options, and valuable extra benefits. While there are some updates for 2026, our commitment to your health and well-being continues to be the same. We're truly honored to be part of your healthcare journey. Thank you for visiting our website, and please don't hesitate to reach out if you have any additional questions. We're here to help.